up there. So I was saying that just like an adult is affected by issues that happen to us, a child is affected in the same way. Allow me to just explain. I'll do more of talking than reading what is on the screen, so kindly follow what is on the screen because I will not read much. But allow me to say that when death happens in the family, I don't know how many of us make sure that the children are taken through counseling. Sometimes when death happens, we hide them, or we even don't explain. Things happen, the burial is happening and everything else. And sometimes we even tell children not to cry. I heard of a situation where a child, after the death of the father, like 4 months ago, after the death of the father, the child wanted the father's name to be written on a birthday cake. And of course, the parents were not able to understand why should you be doing that? And the mother was very mad at the child. And I know this is not now a 5-year-old, this is a teenager who is around 14, 13 years. So what happens is that if you're not able to understand that children also go through these challenges, we will assume that their mental status is okay, yet there is a lot of pain that is happening within them. So that is part of the introduction and much of what I had written there. I can see someone saying they can't see the screen. I hope you can see it there better now. So understanding mental health, of course, this one refers to the cognitive, behavioral, and emotional well-being. Now, when we talk about cognitive, we are talking about how we relate with our mind and how we relate with our brain. I remember that is what I began by saying. Then how our mental status affects our behavior. The next thing is the emotional well-being. When we mention emotions, we are talking about anger, bitterness, we are talking about unforgiveness. Those are things that affect our mental status. I don't know whether, just to bring it closer, I don't know whether you've seen a person who has kept bitterness for a long time. When they are provoked by someone, just something very, very little, and you burst out. This is a person who never dealt with emotional issues that had been caused by some things that happened to them. They never dealt with it. And that one now has become a challenge that is affecting their day-to-day living. I hope that one you can be able to connect. Then, of course, it includes emotional, psychological, and social well-being. So how we also relate with people is as everything to do with mental health. It also affects how we think, feel, and act. So how is your thought pattern? What do you tell yourself when you are alone? When you're talking to yourself, you know what we call self-talk? What do you tell yourself? It also determines how we handle stress, relate to other people, and make choices. It can affect your ability to relate to others and function each day. There are many people, because of depression, somebody is not able even to wake up in the morning and you're feeling low energy and feeling not completely not interested. Now, we only think that these things happen to adults only, but it is important to know that these things also happen to children. And then mental health is important at every stage of life, from childhood and adolescence throughout adulthood. Now, the mental wellness of a child does not begin when they know how to talk. Their mental wellness begins, allow me to go back up to when they are in the womb. It is said that the child is able to detect the emotion of the parent when they are in the womb. So if the parent was too harsh and all the time maybe complaining and with a lot of anxiety, it is going to affect that child as they are born. It is so unfortunate that we don't imagine such things would have an effect. Now, if it has an effect at pregnancy, then it can have an effect at age 1. It can have an effect at age 2. It can have an effect at age 5. But of course, we are living in a society where such things are not discussed. And there is a lot of self-centeredness. I normally see as if we are living in a society that is so concerned about how to make the next coin, how to be able to live a good life, and I'm enjoying it. So it doesn't matter who else is hurt in the process, as long as I made it. And I think these are some of the things that have completely made us even to even forget the emotional wellness of a child. Allow me to connect just a little bit on issues. There's something that I've not mentioned here, which is very key. Those definitions of anxiety, depression, panic attacks, and suicide attempts. Allow me to add trauma. Trauma is anything that happens to a person that has causes emotional pain. Things like death, things like sexual abuse, emotional abuse. Emotional abuse sometimes is even worse than the physical, because emotional abuse has to do with the words you speak to a child. Like when a child is told you're good for nothing, you will amount to nothing, you cannot be anyone in this life. Those are emotional abuse that will cause the child to grow with trauma, pain, and this pain is kept in the mind of this child throughout their life, and it also affects their adult life. There are so many people who behave in a certain way today, and they are adults, but it is because of things that were done to them when they were children. So an emotional, of course, anxiety now is an emotional characterized by feelings of tension, worried thoughts, physical change like increased blood pressure. Allow me to just bring it home. Anxiety is like when your mind is like running so fast. When you think about something, you almost like you're sweating about it, like you're waiting for an exam, and it is so traumatizing that sometimes you're not even able to sleep. And anxiety is connected also with things like somebody is shaking, somebody is like when you're told even to speak before people, you're sweating. It is characterized by many things. It is a feeling of fear or apprehension about what to come. So it has to do with like you're fearing either to speak before people or an exam that is coming, or maybe something you are expecting, like, and especially for children now, this one has to do with like issues of like a coming exam, exposing them to new people. This is something that we do a lot as parents, exposing and forcing children to be involved with people that they do not know. Then there is behavioral and emotional signs, of course. Now, these are the signs of anxiety. There's behavioral changes, that is moodiness, aggression, short-tempered, clinginess, development of nervous habits, such as nail biting. I know most of us think that it is innocent for a child to just bite their nails every time they are talking, but sometimes it may be a sign of anxiety. Then there is difficult concentrating. There is fear, such as fear of the dark, or being alone, of strangers. Then there is getting into trouble at school, hoarding items or seeming insignificance, refusal to go to school, withdrawing from family or friends. Then the physical signs of anxiety is bedwetting. That is bedwetting beyond, of course, the ages when the child is very young. There is the time when the child is able, like from above age 7. Now those are issues of anxiety. There are children who go through bedwetting even in their teenage, and it is traumatizing. Allow me to say it is traumatizing for any child who is bedwetting. In fact, they need a lot of support. It is not the time to castigate them and tell them how they are dirty and they cannot even remember to take care of themselves. Please offer them support. Complaints of stomachache and headaches, decreased or increased appetite, other physical symptoms, of course, sleep disorders and nightmares. All those are signs of anxiety. Then now there is depression. And depression is a mood disorder that involves persistent feeling of sadness or loss of interest. You're not interested with anything. You wake up in the morning, you don't want to go to school, you don't want to talk to anyone, you don't even want to take a shower. Remember, this is a child who was doing these things. Then all of a sudden now this behavior begins. It affects how you feel, think, behave, and can lead to a variety of emotional and physical problems. And this is where I was saying depression, of course, will now affect even our physical health. And it goes to high blood pressure, gets into depression, even diabetes for children. All those challenges will be found there. These are the signs of depression. And remember, these signs are not for adults. It affects both adults and children as low as 3, 2 years, 4 years. All the time a depressed mood, reduced interest or pleasure in activities once enjoyed, change in appetite, unintentional weight loss or gain, sleeping too much or too little, agitation, restlessness, pacing up and down, slowed movements and speech, fatigue or loss of energy. Now, allow me to just mention a little on depression. A child may overfeed or underfeed because of the depression aspect. You find the child is wants to just eat and eat and eat, and it's like they're not getting satisfied. Then there are symptoms like, of course, sadness, extreme sadness. There is irritability. They become rude. Clinginess. You find the child all the time, they are too tight. They don't want to even release their hands. And when you speak to them, they are holding their hands tight and it's like they're just folded. Mostly children who you find all the time, they are seated and they are holding up like this. It may be a challenge that they are having issues of depression. And then, of course, too much worry, aches and pains that are unexplained. Even when you go to the doctor, all the chemical and the physical examinations, when they are done, you're not able to see any disease. Then refusing to go to school and being underweight. And then there are, of course, we said irritability, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive. Parents, allow me to say this, that when you see a child's grade dropping, it is important to not start making noise, which is the first thing that we do. It's important to understand, is this child going through some challenge somewhere and it is causing the drop in of course, in the academics. Then there is using recreational drugs or alcohol. Now, this is another challenge with parents. When we see our children using drugs, we are quick to even like beat them, punish them, but unfortunately, they may be going through depression. Things they went through when they were very young and they were unhandled. One of the areas that we've handled a lot anytime I'm dealing with drug and substance abuse is parents who have divorced. Parents who maybe all the time there is a lot of quarreling in the house or fighting, domestic, of course, violence. Then there is loss of a loved one. These ones predispose children to drug and substance abuse. And then there is, of course, eating, sleeping too much, self-harm. You find sometimes a child who is depressed will like have along the heart here, I don't know whether you can be able to see, these are the veins. There are some veins here. They take razor blades and cut themselves because it is a way, of course, they tell each other, it is a way to easily kill yourself. Those are self-harm. Then there is a child maybe keeping things like razor blades, keeping scissors, keeping a lot of medication in their lockers or in their closets. Those ones may be things they are keeping to be able to harm themselves. So it is important to just even keep checking. What are your children keeping in their closets? Then there is loss of interest in normal activities. If they like going out and to play, they're not interested anymore. And then there is avoidance of social interaction. Then there is the panic attack. And I'm feeling like I will just go through these very fast. The panic attacks come because of some events that happened to you, to a child when they were young. Allow me to just give a very easy example. Like when a child is young and we like pushing them to go to the swimming pool. And if they go to the swimming pool and they drown, especially when they completely cover their head and they feel like they're almost dying, that one can cause panic attack. Another thing that causes panic attacks, it is when like parents are fighting and the child almost sees as if the parents are almost going to kill each other. That one can cause panic because every time they hear noise where the parents are used to fighting, it causes panic. Now, remember, these are disorders that are now completely have affected the mind. Normally, with these ones are panic attacks, anxiety, and depression are treated with medication in line with psychotherapy. But of course, there are some that, if they're not very extreme, can be handled with psychotherapy alone. Psychotherapy is counseling. It can lead to panic disorders or a type of anxiety disorders. Panic attacks usually first occur during the teen or early adult years, but people of all ages, including children, can have panic attacks. Now, this panic attack can be so serious that sometimes you are not completely unable to sleep at night or unable completely even to go about your day-to-day activities. Now, these are symptoms of panic attacks. And Alex, I don't know how my time is because of that time we were not able to, we lost there. Kindly advise.
Yeah, just keep going. I think we have like 15 minutes or so.
Okay, let me try my best. Now, chest pain and chills. Now look, these are physical conditions. So I'll go to hospital, going to be treated for chest pain, but the problem is not the chest, it is panic. And it is a mental issue. Then there is choking. The smothering sensation. All the time you feel like there's something that chokes you when you speak, because there is a pain that is within that has not been dealt with. Then there is difficult breathing. Imagine. So somebody will go for treatment and you're imagining, of course, like now the condition of COVID and the rest. Fear of losing control, feeling like you are going to die. All the time you're feeling like you'll die. Intense feeling of terror. There is nausea. Raising heart and sweating. These are physical conditions, but they are mental. Their source is mental issues. Then there is numbness of fingers and toes, trembling and shaking. So those are some of the things that, of course, somebody is going to experience if you're having. Then now there is the suicidal attempt. Allow me to not read all this that is here, but just say, if you have constant thoughts of dying, all the time you're planning on how to end your life, it's like you're thinking, which is the means that can make somebody die very easily. And then too much hopelessness. All the time you're looking down on yourself, you feel like you're filthy, like you don't belong. Remember, these are things that a child goes through. Now, unfortunately, a child will be going through all these things without the knowledge of the parent. It is so unfortunate because like the young children or teenagers that I've dealt with, most of them go through all these emotions without the knowledge of the parent. And unfortunately, even when they're going through these things, parents are also making a lot of noise and on their case and really annoyed about them. So you can imagine it's like you're piling up issues on top of another. So yes, mental issues are such a big challenge in our time. May the Lord help us to be able to be alert enough so that we can be able to help our children. So I was saying down there, among teenagers, it may be associated with feelings of stress, self-doubt, pressure to succeed, financial uncertainty, disappointment, and loss. For some teens, suicide may appear to be a solution to their problems. Of course, there is so many things that are happening and the child is like, I think I'm better off dead than just being able to continue with this life. Remember, these are real issues that we face in the counseling rooms. Things that are real happening to our children. Then there is family history of suicide attempts. Those are the risk factors. There is exposure to violence. When the child is exposed to violence, of course, and I said violence can also happen between parents or even between siblings, or living in an environment where there is a lot of violence, there's impulsivity, there is aggressive or disruptive behavior. Then there is bullying. Bullying can be of all types. There is the physical, social, even cyber bullying that is happening a lot in our time. There is feelings of hopelessness and helplessness, then acute loss or rejection. So remember, rejection, of course, is from close friends, because for a child between the age of 1 year to 12, how the parents treat them is key. For a child between 13 to 18, how they are treated by other people is key. So if they're mistreated by their friends, they may feel that hopelessness. If a child between 1 year to 12 is mistreated by the parents, they may feel mistreated. Then, of course, causes of mental issues, academic pressure, pain, injury, illness. A child may have gone through a long-term illness, and it might cause them those mental issues. Then there is big change in the family, like after divorce, death of a loved one, moving from one place to another, or even moving schools. I know this is something that mostly parents, we are not alert about. And sometimes we move children even up to 5 schools. That one can cause them mental disability. And then there is parental instability, there is bullying, there is peer pressure, there is scary movies, there is going through body changes. Allow me to just mention a little bit about the scary movies. Although we are now living in this time where information is everywhere, a child can get onto YouTube, Instagram, everywhere and get information. It is important to control what they watch according to age. Because in the younger years, if they watch movies that are horror movies and these things about people killing each other and a lot of death, we may destabilize their mind, because remember, the child's brain has not developed. Allow me to say that the brain of a child develops fully. For the girls, is up to around 22 years. For the men, is up to around 24. That is when the brain fully matures. Now, remember, depending with the stage the child is in, you can't afford to just expose them to all these things that an adult can be able to manage. And that's why we even avoid as much as possible a child being exposed to drugs. when they are below the age of 21 or 22, because they are being predisposed to becoming addicts very early in life because their brain has not matured yet. That is a topic maybe for another day. Maybe we can get deeper to that. Then there is, of course, now going through body changes, the body changes that children are going through during adolescence. I know how we like telling them, hey, and nowadays you become so big, you know, you've become so fat. And sometimes we think it is just an innocent statement that we are causing them pain. In fact, we call it body shaming. For any reason, parents, please don't joke with the changes that are happening in the body of a child. Then, of course, now there is the things that happen around us, crime and all that. So how can I identify a child with mental issues? Persistent sadness that goes beyond 2 weeks. If a child is looking sad throughout, then there is withdrawing from or avoiding social interactions, hurting oneself or talking about hurting oneself. There is talking about death or suicide, outburst of extreme irritability. There is out of control behavior that can be harmful, drastic change in mood, behavior, and personality. Let me just summarize these with a few words. Say that if a child remains sad for a long time, too, the child was not very rude, and all of a sudden, when you talk to them, they are very rude at you, it is important to know what might have caused that. Then there is drop in academic performance and how they relate with other children. Those are some of the areas that can help you understand that maybe your child may be going through some issues. And then, of course, preoccupation with death. All the time thinking about death. Ooh, I think I went to a next screen.
Escape, yeah, escape first, go to the slide.
Okay, let me.
There.
Yeah, so we were talking about changes in eating habits, loss of weight, difficult sleeping, frequent headaches or stomachache, difficult concentrating,
you can have it
changes in
feel.
Academic. Yes?
Feel, just feel the presentation.
Okay, sorry. Yes. Changes in eating habits, loss of weight, difficult sleeping, frequent headaches and stomachache, difficult concentrating, changes in academic performance, and avoiding or missing school. So these are some of ways we can be able to identify that the child is having issues. How can we prevent? Provide a safe, secure, and dependable home. I know this is not easy. I understand it is not possible sometimes, but we can try. Especially if we have issues maybe between husband and wife. It is important not to discuss or have those fights before children. Try your best. If you're fighting, fight in the bedroom. If you must fight, please don't fight before them. I know sometimes because of the anger and the emotions involved, there is the outburst and everything. But if you can, as much as possible, protect your child from these things. If there is, of course, a loss that has happened, if possible, take that child for counseling. It is important for them to be taken through those painful experiences. Just the same way you're feeling the grief, the child is also feeling grief, including the death of a grandmother. Unfortunately, we think they were not very connected with that person. Maybe it may not affect them. So set family routines can be comforting, having a family dinner, be a role model. Be careful about which television program, books, and games that the child is watching. Keep your child informed of anticipated changes such as jobs. Now, there is something again about the change of jobs. Like there is a certain lifestyle you had been used to keeping your children in, and when there is loss of job, we don't explain to our children. That one affects them a lot, because you're taking them from a certain social status to a lower social status that they have not expected. It can cause a mental disability. But if we can be able to explain to them that transition, we make them even be able to be better. Keep your child, spend calm, relaxed time with your children. And I did not say that we babysit our children. Please set 10 minutes, 20 minutes to just know, how was your time in school? How was it? Hug your child. Some of our children don't know what is hugging. And that's why by the time they are teenagers, when they are touched by maybe people of the opposite sex, they are like, wow, because they have never been hugged in their time. That is part of helping them mentally. That fits their emotions. Then of course, learn to listen to your child without being critical. Work with your child to help them understand and solve what is upsetting to them. Build your child's feeling of self-worth. Don't allow them to be defined by society. Let them have gotten that affirmation from you as the parent. Allow the child opportunities to make choices and have some control in their life. This one goes to the parents of teenagers and young adults who feel that their children don't know the courses they need to do. So a child comes and they say, I want to do engineering. And you're like, no, our family, we only become doctors. So allow your child to be able to make choices, encourage physical activity, recognize signs of unresolved stress in your child, and then seek professional help. Then of course, the treatment for all these, in case your child is all these things that we have discussed, seek psychotherapy. I said that is counseling. There is interpersonal therapy and cognitive behavior therapy. Those are things that we can be able to be done by a counselor. Also seek medication. Medication is only given by a psychiatrist, a doctor who is specialized in mental health issues. They are the ones who handle the medication aspect. Counselors don't offer medication. We offer psychotherapy treatment. That is what we are trained to do. We are not trained to offer medicine. Thank you so much. And of course, in conclusion, stress may be a response to a negative change in a child's life. In a small amount, stress can be good, but excessive stress can affect the child's way, the way they think, act, and feel. Children learn how to respond to stress as they grow and develop. Many stressful events that an adult can manage will cause stress in children. As the child grows, he learns to cope and handle stress. Thank you so much for listening to me. Sorry for taking a little bit longer, and also sorry for not being able to begin in a way that we were able to get it light, but I know we've been able to get 1, 2, 3 things that can be able to help us in the future. Thank you so much, everyone, and may the Lord bless you.
Wow, wow. Asante sana, Anne. That was quite a helpful conversation. Anne is going through the questions, even as she helps in asking the questions. I think for me, my greatest take home, 3 major take homes for me. Number 1 is that there's so much we can do to ensure that our children remain mentally, in other words, they have good mental health. And I hope you're still taking the questions. So, and basically the environment, how we keep our homes, how we avoid, trying to keep issues of stress around them. But I just, when I was listening to Anne, I felt you can do the best you can. Again, that doesn't stop a child from getting into a situation of mental health. And if that happens, it's not like you failed as a parent. Things could be external, beyond your home and your family. And Anne has given us what to look out for. And for me, in a nutshell, what came out strongly is when you see a change in behavior. Of course, Anne has mentioned so many things, but when you detect a change in behavior, that is a huge red flag that you're meant to watch out for. Then finally, I think for me, what also is, once you discover there's a problem, there's a change in behavior, there's something you've discovered, always be willing to reach out for help. Be willing to talk to a counselor, be willing to talk to a professional, because a lot of problems that we struggle with in adults, if they were detected and resolved when they are young, we will not be struggling through those things. I think those were my major take homes. And I really, really appreciate, I think, just giving us the overview of that. So I would ask Anne to help me with the questions. Anne.
Thank you, Alex. That was quite a session. Thank you so much, Anne Karambu, for that. A number of us have submitted their questions. I think some of the questions are coming from the aspect of, the signs that a child is mentally unhealthy. And one of the questions was, somebody asked if a child avoids social places, such as to the extent of avoiding church, please advise. I think you had mentioned something about one of the signs being withdrawing from or avoiding social interactions. Maybe on that line, I can ask, as this child is avoiding social places, is it possible to just tell from one sign, or do you also need a concoction of signs to tell that your child is needs some mental attention?
On the issue, of course.
Would you prefer to ask them all or just go one by one?
If you can be able to combine those that are relatable, then read them together, maybe that is better.
Okay, there's that one about avoiding social places. There's also someone who said that you mentioned that the signs of depression can affect children as young as 3 years. And so how would one tell if a child of 3 or 5 is suicidal? Then there's a question about early pregnancies in teens. Maybe the question would be, is that also a sign of the child? Is it a result or maybe a sign that a child is mentally unhealthy?
Okay, those questions are different. The first one, especially, of course, of avoiding places, and especially the aspect of avoiding church. Children, and I would really decide, maybe the person would have said the age of the child, because I want to imagine that this child is around, is in the teenage years. From the age of 12, I said the child draws attention from what are other people saying. Yes, I get it, it's 12 years. What are other people saying about me from age 12? So they're very concerned about how other people think about them. So you realize if the environment they're in, they don't have friends who are closer to them, they will avoid to go to those places. So the child may not be having any mental issues, but it may just be the aspect of the developmental stages that are happening in their life, and they want to be in a place with people they know. They want to be in a place with people that they can relate with. And that is what I see mostly with teenagers. And that's why I see most teenagers That's why I see most teenagers avoiding church and even avoiding to go for even family gatherings. It may not really have anything to do with a mental issue. It is a developmental stage. Now, what is a parent supposed to do in such cases? Of course, encourage them, one, to be dependent and not to depend on other people. Two, you can also be a friend to your child so that they don't need other friends to keep them company, but they can afford at least to have you as a friend. Now, if they don't have you as a friend, definitely, they will not accept to even go to that church. And of course, encourage them to have friends in that environment. The next one was the question on if of course, a 3-year-old may not be thinking about suicide, not unless a child has watched movies or games that are associated with self-harm. If a child has been exposed to things of self-harm, that is a 3-year-old. But from 4 to 6 years, a child can be able to do things that are self-harming. So it is important to be very close. I talked about a child being clingy all the time. They don't want to talk all the time. They are sad all the time. This is a 3-year-old. This is 3 to 6. When you like even want them to play, they don't want to play. Sometimes when you touch them, they panic. That is maybe if a child has gone through abuse. When you touch them, they become clingy. Those are some of the things we can be able to observe and know that they may be going through a challenge. There is something I did not say as I was talking. Our children go through a lot with the house helps we leave them with at home. Some are beaten, some are abused, others are exposed to even pornography, others are exposed to even sexual abuse. I remember there is a friend of mine who was telling me, and this is nasty, that the house help was feeding the child with poop. I hope we got that. So what happens to this child? The child had already begun the milestones of speaking, walking, and they began to regress. We call it regression. So the child they had begun talking, they had begun feeding themselves. All of a sudden you start seeing the child not able to do milestones that they had already begun. That is a sign that the child may be going through a traumatic experience in their life and it is affecting them. That is the ages of 2 all the way to 6 years. I hope we got that one. Then the issue of early pregnancy. Because I have written this book on talking to our children about sex and sexuality, it is not a mental issue. Allow me to say that a child is sexually aware of their sexual impulses as early as, I don't know whether it is 3 months or 3 weeks. I support this by explaining, maybe, I don't know whether we see when we are changing, I understand we are talking to parents here. When you're changing a boy, you realize that there is an erection happening. Even as early as 3 months, 4 months, as you change their diaper. This is to tell you that the child is active. The body is active sexually in every area. And that's why you see, even for the girls, they will start wanting to touch their susu areas. So if we do not begin a conversation about sex early enough with a child, we are predisposing them to begin sexual escapade when they are very young. Unfortunately, we are living in a time when our children are exposed to so much information that we have little control over. So as I said, they can be exposed to pornography and all those manner of things, even by their cousins, by their older children and everything. So what is going to control this child if we never talk to them? So begin slowly, a guide from 2 years, guide them. Things like don't allow people to touch your private parts, 2 years to around 5. By 6 years now, you're helping the child to understand the body, their body. By 7 to 9 years, the girls are supposed to have understood their menstruation and that they can get, and that they can even get pregnant. Because remember, our children are beginning their menses early. Some are beginning at 9, others 10 years. It is not like when we were growing, it was going all the way to 13, 14. So issues of early pregnancy has nothing to do with mental issues. It is us parents who have to take personal responsibility and guide our children early enough. Just give them enough information to guard themselves. I think I've been able to answer those 3 questions.
Yes, thank you very much for that. Okay, I have a question. This one is my own. When a parent has mental issues, is this something that children can also get mental issues based on the behaviors of the parent? You know, if maybe a parent is suffering from maybe depression or stress or anxiety, and the way they behave, is it possible for a child to also get to a point of having mental issues because of the parents' behavior?
People say hurting people hurt others. So whether it is a parent, whether it is a child, whether it is a sibling, as long as they are hurting, they can also hurt others. Kindly, Jackson Mwangi, if you can mute your mic kindly. So when a parent is hurting, they will pass the hurt to others. One of the things that I've seen happen, although I think we call it generational curses, allow me to say that a parent who has trauma will pass that trauma to their children. And because these children were traumatized, they will also traumatize their own children. And the cycle continues until one generation seeks help so that they can be able to stop that line. And that's why you realize if a parent went through rejection, they reject their own children. The children also get children and they reject them. And it is a whole cycle that looks unstoppable. And of course, in our Christian circles, we call it curses. But it is not a curse. It is just mental issues that were never dealt with in a certain generation, and they have been being passed from one generation to another.
Thank you so much. For maybe one question I might have overlooked when we were talking about signs of depression. Someone is asking if a child is always pretending not to hear, or only to come later and ask what he was being told. Is this a sign of depression?
Again, I will ask the age, because that is a behavior of a teenager. There are things that are happening in the mind of a teenage. If the person who had asked that question kindly, you can 7 years. 7 years now. That is not a problem. That is disobedience. That is not an issue of teenage. Now, there is one challenge. No, it is not a sign of depression. It is not a sign of a mental issue. There is one thing we do as parents. When children are younger, we don't discipline them. We begin disciplining children from the age of maybe from 10, others begin at 13. Unfortunately, mostly we have lost it. For the parents who are here, allow me to say that you are the first authority that the child should be able to meet, not the teacher in school. I hear parents telling children, I will report you to your teacher. And I'm like, we are going to wait until the child goes to school so that they can be disciplined. There is nowhere where it is written that the teacher in school is the one who is supposed to instill discipline in a child. And allow me to take it back, that the discipline begins at 5 months, at 6 months, at 8 months, at 1 year. I'm talking about a toddler. The child should be able, as they are breastfeeding, they should be able to see you as an authority. And I am not saying that we beat our children to death. I am simply saying, let the child see you as an authority, such that if you say do this, a child can easily rush and do it, not do it at their own time. I know now that goes to parenting. It is not mental issues. And what happens if we do not take this child through these changes rightly? We are predisposing them to mental issues. Because what happens, this child who is disciplined, when they go to school, they will be disciplined by the teacher proper. These are the children who disturb in class. These are the children who will not shut up. These are the children who are given homework and they don't want to do because they are not used to authority. They don't know authority from home. They have had authority for the first time when they went to school. So they will still try to defy even the teacher. So as a parent, that is a parenting issue, really, not a mental issue, not unless it is something that has just come up and it was not there. But remember also, a 7-year-old is also maturing. So they are also even beginning to realize, and remember the child observes parents. So when they realize you are a relaxed parent, they will try to challenge. They will try to challenge you. I have those years that you are talking about. I have a 14, a 10, and a 5-year-old. And I will tell you, around 6 to 10 years is not easy. It is that time, if you did not discipline down there, they will challenge you proper because they have even started to learn who between the mother and the father is more tough than the other, who accepts everything they are told, they say. So it is very important to have done the discipline aspect. But yes, in the future, it can cause mental issues because when they go to school and they are disciplined all the time, what is going to happen to this child? They will start looking down on themselves. And already now we are destroying their self-worth. We are destroying their ability even to be able to perform in class because we did not instill the discipline that is needed.
But I'm believing there is still hope to probably the parent who is slightly late.
Yes, a lot of hope. And that's why we are discussing this. There is hope even for the 18-year-old parent. Where the hope is the realization that I did a mistake. So you don't put so much pressure on this child. You have to step down and stop complaining. Allow me to just mention a little bit about children maybe who are not able to perform some chores in the house. But it's because we never guided them on how to perform them. Now, instead of the parent complaining that my daughter, my son does not work, you can be able to offer them support and even extend mercy and grace to them as you're guiding them on what to do. But now, unfortunately for us parents, even when we know for sure we did not guide them, we complain to them. So if you know that maybe you did not, there are things you didn't do on the child when they were younger, what you do is you make sure that you start instilling them slowly, not with the same force you would have used for a toddler. Because a toddler, remember, is not speaking, but now the 7-year-old is talking. So there is a force we will come with and we lose them. So yes, there is hope. Alex.
Thank you. Thank
finally,
you.
Before I hand over to Alex, we have a number of people requesting for the notes and the slides. So I don't know whether that's something
yes, I will share.
Okay, so anybody who would like the notes or the slides, you can leave your emails there, or you can also fill our form, which we'll really appreciate. So on to you, Alex.
Wow, great. As I'm concluding, I would really ask Anne to share the page of her contacts. There's a page that you have for your contacts, just so that people can, because I know some of us would, I know probably you would want more information, but even as you leave your contacts, you'll be able to contact you and share a little bit more. Yeah, so that's Anne's consultancy. She, as I mentioned, she's a counseling psychologist. She counsels all the way from children to adults. In case you have anything, you can always talk to her. You can always email her, and she'll be glad to help. Yeah. So mine is just to say asante sana to Anne. I have really been enlightened. I think, especially for my take homes, I've discovered that you know, as parents, we have a huge responsibility, and we have to be present in the lives of our children if we want to ensure that they grow up in mental wholeness. And I believe that the flip side of having mental issues is that if you are present, if we keep encouraging them, if we keep positive vibe in their lives, they grow as confident kids, and that is what we are hoping. So in case, again, probably your question was not answered, feel free to email Anne in her contacts and her telephone. Feel free to be able to get further information from her. I want to close there. We had hoped to end by 8:30. We are just 8 minutes late. So we apologize for just a few minutes. And again, I believe it was time well spent. So I think I'm just going to leave it there. Again, if you want the notes, kindly post your we'll be around in the chat for some time. Post your email address. We are going to do that. If you have any other further questions, we'll be able to assist on that. So I just want to close with the word of prayer. But before we close, just a quick word about Pedion. Once again, for us as Pedion, we just seek to empower and equip parents, children workers, and the church in general towards wholesome and effective children ministry. Yeah, and this includes their mental health and everything. Again, if you would like to contact us or to partner with us in any way, feel free to get in touch with us. Anne is going to share the telephone contacts, or at least the email of Pedion, even as we leave. Yes, so once again, to thank each and every one of you for making time, for creating time to be here, whether you're here on the chat or you're on Facebook. We really appreciate your time, your questions, your comments, your feedback. We really appreciate. So asante sana.